Good evening, everybody. So today I came with a topic of presbyopia. Okay, so very commonly said it is a condition where the patient can see the near object clearly after the age of 40, right? But if you look at the scientific definition, so it is a condition that refers to naturally causing irreversible reduction of the amplitude of accommodation that is sufficient to cause the blurring of the near object. Okay, so if you comes to the how to manage or the management options, so there are only one management option, that is to use the addition power. Okay, now this addition power can be given to three different types of presbyopic patients. So first one is those who are pure presbyopes, those who don't have any distance refractive correction, only needs the presbyopic addition. The second one is the hypermetropic presbyope, those who have distance plus correction, requires near add also. And number three is the myopic presbyope. Okay, those who have minus correction for distance and also need the reading addition. But when you ask the patient to wear the glasses, mostly it is very easy to tell, or easy to understand for the patient, those who are the hypermetropic presbyope or those who are pure presbyope. But it comes to a very difficult when it comes to a myopic presbyope, because whenever you ask them to change the glasses with and buy a new glass with the near addition power, the first question comes to you, that patient usually asks, why sir, I can see clearly without glasses for near, then why I should use the glass for near? I can not see at the distance, so I use the glass for distance only. So whatever they are telling at their point of view, they are correct. But as of a eye care practitioner, it is your responsibility to explain, to inform the patient about the condition, why he needs to wear glasses for looking at distance, and after wearing the distance glasses, why he needs to wear the near addition also for looking at near object. Okay, so mostly those who are mild to moderate myopes, like -2 or -2.50 at the initial age of presbyopia, like 40 to 50 age, they are not interested to using glasses, because whenever they are looking at the near object, they just remove their distance glasses and can manage the near object very clearly. Okay, next comes next one more complaint we usually get from patient, or usually get from the eye care practitioner also, like what kind of glasses we should prescribe. We should prescribe the bifocal glasses, or we should prescribe the progressive glasses. So now comes to the factors which has to be considered before prescribing a presbyopic addition for patient. Okay, so there are mainly three things which you have to consider. Okay, the first one is the near visual demands of that patient. Near visual demands, so mostly the near visual demands comes from the patient occupation. So what is the patient daily profession, what is the patient used to do daily? Okay, that is one. And number two is their working distance, so these two factors should be considered first, then we can come to conclusion what kind of glasses will be the suitable option for the patient. For example, if a patient of age 41, but his profession is goldsmith, so he has to work at a distance of 25 centimeter, like this distance. So in spite of his age being 41, you have to, mostly in that case, you have to give plus 1.75 addition for making them the comfortable near vision, or comfortable with their profession, because their working distance has very much reduced and their posture is also not correct. Okay, but at the same time, if a 41-year-old patient who is a computer user, that time you should give the age-wise addition power. Okay, so this is the example I am giving, how the working distance and the patient's occupation or the near visual demands change the addition power of in case of presbyopes. Okay, next comes in the bifocal or progressive. So as of the bifocal, you know, like there is only a distance power and then one near power zone. So if their patient has distance correction also, mostly in the myopic presbyopic patient or high hyperopic presbyopic patient, what happened? No, they will directly jump from distance to near. Suppose distance is -2, near is +1, so they will directly jump from -2 to +1. So this creates one image jump for this bifocal new user bifocal patient. At the same time, so this image jump has been one so this image jump has been corrected in the progressive design, but at the same time the progressive design has also one difficult to adaptation, because when their side view is being limited, mostly if they go with the very basic design of progressive. We used to call this as hard design, soft design. So mostly in the market there comes a new type of progressive lenses which is called the free-form progressive lens or free-form pals, which is customized according to your facial shape with the appropriate pantoscopic tilt, vertex distance, frame selection and all. Okay, but that is quite expensive. So but if the patient is go with this very basic model progressive lenses, no, they are not getting adapted with the progressive lenses, so they always used to come back to the clinic and complain, I have bought this new glass, I can't even see anything, it is it causing headache, it causing some nausea feeling in whenever I used to wear these glasses. So the safest option is those who require mostly the near correction, okay, like the goldsmith or the tailor. Okay, so this kind of profession is better to go with the bifocal kind of glasses, and mostly those who don't have any distance power. Okay, only for the pure presbyope who has only presbyopic addition, go only with presbyopic addition, and the work demand is mostly at the near, so better to go with a plano reading glass or go with a plano bifocal, I mean distance plano and the near additions one. Okay, otherwise but if a patient has distance refractive correction also, it is better to go with the progressive lens, because that image jump will be rectified. Okay, but at the same time you should tell that patient that as if you are going with the progressive design lenses, so there will be an adaptation issue for 2 to 5 days initially after wearing that new glasses. Slowly you have to be adapted, there is no need to worry about that. Okay, and try not to explain patient about this very basic design, because basic design progressives are very difficult to adjust. Or okay, now comes to the third question. Sometimes after prescribing glasses from here, that patient when goes to the opticals, okay, from that opticals we got sometimes called like patient only asked for the near glasses. So what power we should give? Suppose for the example I am telling, patient has a power of +2 with -1 90 degree and with a near addition of +1.5, right? So what power we should prescribe for if the patient wants to take glasses for near only? So those so should I give the addition only, or should I give the distance plus near? So for investigate everybody's do that they only give this addition power, but it's not correct. So if you have to give the only the near power, the patient is willing to buy only for the near vision glasses, so you have to give the distance plus addition power is equals to the near power. Okay, so if for this case +2 with -1 90 with addition of +1, so the near vision glass power will be +3 with -1 90 degree. So you have to add the distance spherical power and keep the cylindrical power as it is and axis as it is. Okay, so if you miss the cylindrical power, then also patient might complain of some it's not getting that much of clear when you check with the trial frame. Okay, so these are the 3 basic complaints what we get from the correction of presbyopic patient. Thank you. In the next we will come to a topic of the what are the advanced treatment options for presbyopia. Okay, so till then stay tuned. Thank you.